Hello, another video of mine. I know I'm doing two in the month of May. What is up with that? It's just been a busy month for me. Okay, so as some of you may have noticed from the previous video, I've talked about having a colonoscopy done. I did get that done. I got that done on the 18th, which was last Monday. And I'm going to kind of tell you a little bit about it and um, what they have found and what it all means. So I did get my shirt. There's a big picture of an alien, like an alien spaceship, and looks like a person being like transported up. And it says, "Get in, loser. We're doing butt stuff." I did wear that to my appointment. I'm sure that probably embarrassed my youngest daughter who took me, but I don't care. I'm in almost my mid-40s now. I can do that stuff. I'm entitled to it. Right? Right. Okay. So before then, I had to prep for the procedure. So, I know some people are thinking, oh, you probably got like this big old jug of nasty stuff that you have to drink. They actually, what they do, which is something my mom did when I talked to her, is they allowed her to do like Gatorade and Miralax mixed in there. So I had two 28-ounce bottles of Gatorade, and it looks like this. No, there's no Miralax in there, so I'm not going to crap my pants today, okay? If I do, it's for other reasons. Believe me. Um, anyway, so I had to sprinkle this powdery stuff of Miralax, and it was a lot. A lot, a lot, a lot. So I do half a bottle of Miralax for each Gatorade bottle, and there were two of them. So I had to go on a low fiber diet for a few days before starting, and then the day before I had to stop eating, and I had to take my medicine. I also had to take Dulcolax. That was the first thing I had to take. Then the Gatorade mixed in with Miralax, and some Milacon, or it's like, kind of like gas relief. Or some people just use like Gas X tablets. But I use the Milacon because it's liquid and I could put it right into the bottle, shake it up, and it just makes it a lot easier. Um, Not fun. Not fun at all. And I just, it was coming out. No, I did not lose like a Barbie shoe or wad of gum or anything that came out from my childhood. It was pretty clean. It's some of those scary stories that people love to post. But yeah, it was an experience. Good news, I did it right. So they were very happy with me that I did it properly. And because I've lost so much weight, I was actually able to do it in ambulatory care. So I didn't have to worry about doing it in the OR, which was even better. And I'm sure my insurance company will thank me bunches for that because that's less cost. Usually it is. Maybe it's not anymore, but we shall see when I get the bill. Anyway, procedure went well. They gave me medication. So I wasn't knocked out, but I was loopy. So I was kind of like watching the camera, like going in. And I was kind of chuckling to myself a little bit, thinking, wow, this looks pretty funny. What am I watching? I'm watching my colon and my intestines. So it went well. There are no polyps. I don't have any hemorrhoids, and no ulcers or polyps or anything like that, which was great. But they did find something. So what they had found was what they call a mucosal oozing. So which came from my liver. They said usually that happens when somebody, has like liver disease or some type of a serious health issue, which, I have autoimmune hepatitis and liver cirrhosis, and I'm a liver transplant list, so that makes sense. So basically what it does, it's a little bit of blood that gets like oozed out from the liver into my intestine and my GI tract. So it's like slow. It's like a slow drip. It's not like major, but it could be if not watched carefully. So we're going to go over that a little bit. I'm going to kind of give you a little bit of a definition on mucosal oozing. Okay, so the definition that I looked up from the National Institute of Health, awesome website to go to and check things out. If you ever have any questions about medical things, like your doctor giving you medical jargon that you have no idea what they're talking about, or it's on your portal, check that site out. And any other sites too that are like .org, that's like, the Mayo Clinic, Cleveland Clinic, Roswell Park, any of your hospitals, they usually will have like literature, and universities as well too that participate with medical hospitals. So those are great places to check. I actually learned about that when I was going to school to be a vet tech. So some things I still remember. So, anywho, definition of a mucosal oozing is a slow, continuous seepage or oozing from the delicate lining of organs. For example, the stomach, the intestine, the liver. And then, so right now it's just like a small, like I said, like a small drip, but, not kept an eye out on it, it could be worse. So, and that would actually constitute an emergency. So, there are some issues, yes, with that could arise. So, I have to keep an extra watch out for. So, there is an impaired clotting called coagulopathy. It's just basically it's a definition that the clots don't, like when you get a wound and your body's supposed to clot that site so it doesn't, bleed out. So that doesn't clot. Your body's not clotting like it should. There's also, which can cause, which is what I had for the longest time. I haven't been having this lately, but never say never. Portal hypertension. So that is high blood pressure for many of you that don't know that. So basically what that is, it's portal hypertension is actually in the portal vein. What it does is when you have high blood pressure, the flow of blood actually goes through the smaller veins instead of the portal vein. And that causes them to ooze or rupture. So if there's like too much pressure, it can actually, burst open. And that is a very, very big emergency because you're bleeding out. Thrombocytopenia, I also have this one. So for some of you that don't know what thrombocytopenia is, that is lack of platelets. Hi, I have lack of platelets. I've been having them for Oh, ever since 2008. Yeah, 2008. Started in 2008, and my doctor's just like, oh, it's fine, it's okay. No, that probably what happened when I had my tonsils and adenoids removed and the scab fell off early. But I digress. Okay, so thrombocytopenia, it's a lack of platelets that are used to help with clotting. So what happens is the spleen, your spleen, it's actually on the left side. So you have your lungs, you have your heart, you got your intestine, your goodies there, and then you have your spleen. Okay. Spleen is supposed to be small. It's not supposed to be big. Mine's big. Okay. So what it does is the spleen actually traps the platelets and it increases or gets larger, increase in size. So this can also cause GI bleeding. So we're going to go through also some of the GI bleedings. Hematemesis, which is vomiting of blood. Melena, MELENA. So that's basically like dark tarry stools that kind of look like coffee grounds, or what I like to say sometimes looks like shredded beef. I know that's kind of disgusting. If you're eating while you're watching this, I'm very sorry, but you should not be eating food while watching my videos unless it doesn't bother you. It doesn't bother me. I'm in my mid 40s. I've dealt with dog and cat crap. And it's not just from my animals, it's from patients that I've helped with over the years. So it's, when I was doing my internships. So unfortunately, with the GI bleeding, it could also lead to chronic anemia. Hi, I have anemia as well too. I'm just a bundle of mess. So, how do we manage, mucosal oozing? Once you know that you have it, what can be done to treat it or keep an eye on it? Such thing. Okay. So every year, my liver transplant team actually recommends that I get an endoscopy. So, endoscopy, kind of similar to colonoscopy, only except they knock you out and the camera goes down here, not up my butt. I'll keep that joke to myself. I've had this done since 2016. So I've been dealing with endoscopies for like the last 10 years. It's nothing new to me. It's usually everything looks really good. They also like to check to see to make sure that there's no rupturing of any blood vessels, like especially in the esophageal or the neck area. Excuse me. So that's one of the main things, because you can bleed out and you don't want to bleed out. Okay. That is one way, just to kind of keep an eye on things. Another thing is medication. Medication. Medication is going to be for the rest of my life anyway, whether I get the transplant or not, because I am on Synthroid, which is a thyroid medicine, because I have no thyroid. So I'm already on medicine for the rest of my life, and I'm on several different meds now. I'm on meds to, like a beta blocker. I'm on meds for diuretics, actually, two of them. I'm on medicine to help me poop. I'm on medicine to stop me from pooping. I'm on medicine to help me lose weight, and medicine to help with, acid reflux. It's a whole slew of stuff that I'm on. And it's not going to get any better. I wish that there were like other treatment options to actually have been shown and that actually have been proven by scientists that does work. And maybe someday but it's not going to be today. You know, that's why clinical research for, you know, for humans to participate in clinical research is so important. Um, as much as I would love to participate in something like that, unfortunately, I am not healthy to participate right now. Otherwise, I'd volunteer as tribute. Okay. So, one of the medications that they do offer for management of this, which I'm pretty sure that they're going to talk to me about this kind of stuff when I go and see them in June. And, you know, they might not put me on medicine. They might do that. But I kind of talk to them first about that and see what's going on. Okay. So the first medicine that they do offer for treatment, it's called octreotide. Okay, octreotide. I had to look up how to pronounce it and had to listen on how it's pronounced. And I learned that when I was going to school for medical billing and coding. Oh yeah, my kids got me a pens for my birthday. So basically, what does an octreotide do? So basically, what it does is it reduces the blood flow in the portal vein, so that, you know, when the blood is flowing through the other veins as well, it doesn't cause it to rupture. Okay, so some of the medicines, another medication that they offer, it's called a PPI. PPI stands for proton pump inhibitor. So basically, a proton pump inhibitor is a reduction of stomach acid and it protects the mucosa. I'm not too sure if the omeprazole that I'm on, or Prilosec, if that's considered a proton pump inhibitor or not. I would have to look that up. I'm sorry, I didn't look that up. But if I do, maybe in the next video, I'll let you guys know if I remember. Okay. So, and then another thing that they for treatment, which I've had this done, you know, numerous times, for thrombocytopenia, would be a transfusion of platelets. Now, normally with that, your platelets would have to be down to, like, I want to say, like, under 15 to 17,000. So basically, your body is supposed to have anywhere between 140 to about 400,000 platelets in the body at all times. When it's under a certain amount, that can cause a lot of problems. So it can cause, you know, easier bruising. It can cause you to bleed really bad, to where you're kind of bleeding out. So because your body's not clotting, the platelets are just not there. Now with me, it's not the fact that I don't have platelets, because I have plenty of them. They're just sitting chilling in my, you know, my bone marrow. It's my spleen, you know, my spleen, she's catching all of them. So it's not allowing, she's not allowing the body to get the proper amount of platelets that's needed to do proper clotting, because the liver is not doing well, which is the sucky part about all of this, which is another reason why I need a transplant. So, no, it's no fun. And I've had that done more than once, and I hate it. Every time they do it, it hurts. And usually I don't complain about blood draws or transfusions, but transfusions are a whole other, you know, bag of worms. I mean, it's like for short term. It don't even last that long. And then before you know it, you're down low again. So the octreotide, there are some additional medications I actually looked up for that. So they have something called, this is a short-acting medication that's called Sandostatin. And then there is a long-acting one. It's called Sandostatin LAR Depot. And then the Mycapssa is an oral pill. And the Benfesia pen, which is used to give like subcutaneously in the skin. Now, the Sandostatin, and the Sandostatin LAR Depot, and the Benfesia pen, all three of those are like injection pen or like injections. That are given, subcutaneously under the skin. The Mycapssa is the only oral medication for the octreotide. Okay, now remember what I said about the octreotide. It's supposed to reduce the blood flow in the portal vein. So that's its job. That's what it's supposed to do. So that is enough about that. Yes, I wrote down things because my brain, if I don't write them down, then I'm sitting there talking pretty much out of my ass. And I hate doing that because I'd rather give you guys accurate information versus not giving you accurate information. And of course, if you are going through something like this and you have questions, please talk to your doctor, because I am nowhere near a medical professional by any means. I'm not a doctor. I'm not a registered nurse. I cannot prescribe. I cannot a medication. I cannot perform surgery. I can't do any of that. I took an oath with veterinary technician when I was a veterinary technician and I graduated, but I wasn't allowed to do any of that either. And that was for animals. That wasn't for humans. So it's the same oath, pretty much the same oath. I don't care who you are in the medical field. It's the same oath pretty much everywhere. Okay. So another thing that I've done, or I had to do, and I'm still doing, is an allergy test. So allergy tests, they wanted me to do just to see what type of medicines I am actually allergic to, because it's been a really long time since I've been tested on anything. And usually I am allergic to penicillin and sulfa, but because it's been, since I was a teenager, they're thinking sometimes people can actually grow out of that. So last week we did the penicillin. I did very well. So I'm not allergic to penicillin. That will actually help me when I have to get an antibiotic when I'm on medication for the transplant, after I get the transplant, because that's going to be needed. Next week, I get tested on the sulfa medication. And I don't think I'm allergic to sulfa anymore either, because the furosemide that I'm on, which is a diuretic, has sulfa in it. And I didn't realize that till after I talked with my pharmacy. And they said, oh yeah, by the way, that's got sulfa in it. Do you do okay with it? I'm like, yeah, I do fine with it. So I don't think I'm allergic to that either, but we shall see when I get there next week. Okay. Pretty much my summer is busy, 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 busy. Doctor visits, doctor visits, doctor visits. I had to reschedule my endocrinologist appointment because I had my colonoscopy. The endocrinology appointment was important, but the colonoscopy one was important too because, I was getting blood on my stool. So to me, that's kind of like, okay, blood versus a checkup on my medication to see how I'm doing. Procedure is probably going to be a little bit more important. And I don't regret that decision one bit. The problem is I'm booked out until July. So that's going to be a very busy month. It's going to be an expensive month too. And I have my 25-year high school reunion coming up then as well too. So, I'm just, today and yesterday I've kind of been dealing with a little bit of a stomach bug issue, which is why I'm drinking the Gatorade. No, it doesn't have Miralax in it. And no, the aliens are not going to come get me. They went home. They went home. They decided my butt was not good, so they left. Anyway, I've, since with going through all of my health issues, I have been dealing with a ton of anxiety. And the biggest thing on the anxiety part is not being in control of my body, you know. And I know some people are going to be like, oh, you're in control. You're in control. Not when things happen. That's kind of out of my control. And I'm so used to getting things taken care of and just be done with it. Like if I have to run an errand, get it done and over with. If I go to work and come home, get it done and over with. The kids got stuff for school, get it done and over with. Now I'm kind of at the mercy of my body and dealing with a lot of other things. And it sucks. I've went to therapy. It's not helping. I just, I'm kind of running out of things now. I'm not giving up. Right now, I just kind of need a little bit of a break. But I'm sure especially with the sun being out a little bit more now, it's hopefully going to be a little bit easier. And my spring cleaning, I wanted to get it done back in March. I still have not started it yet. Between not feeling good and my anxiety, I just don't feel like doing it. And you know what? That's fine. Because I'm not doing it to please people. I was doing it for myself just to go through things anyway. And I will get it done. I would like to get it done before I get the phone call of, hey, you got a transplant. If and when that ever happens. Because there are some people who are on the list waiting, never get the call, and then they pass on. And I really hope that doesn't happen to me. So that's why I'm trying to lose weight so I can find a living donor. But the part of asking people like, hey, can I have a portion of your liver? It turns me off on that, So I don't think that's going to be in the cards for me either. But yeah, just doing what I can. My dog, she's been kind of keeping an eye on me a lot lately. She's been laying with me a lot more. She's kind of slowing down a little bit, but she's still doing really good, so I can't complain. She is going to lose a couple teeth in the back. I did look at them. I tried to descale them, and there's no way. I mean, if I try to descale, that tooth's just going to fall right out. That's what happens when they get older. They lose things. I know the feeling. And itchy nose. But yeah, anyway, that was the highlight of my week, and hopefully yours was better than mine. My daughter drove me home. She did fine. We got home in one piece. I was still kind of loopy. I was hungry, starving. I ate, and then I just crashed for the night. So the highlight was my shirt. The nurses saw my shirt and they all just cracked up laughing. They loved it. I'm thinking, you know what? That should be like that should be like the, like the mandatory thing to wear. You gotta get a shirt that says that and wear it for your colonoscopy. Never a dull moment with me. It's probably why my girls are embarrassed of me half the time. Itchy nose. It's allergy season. Alright, so you guys have a good day. It's probably going to be a while before I get back on here. Probably looking at the end of summer, maybe beginning of fall, unless something changes. So, but I try to keep everybody posted on my Facebook group, Rachel's and Health Transplant, Liver and Health Journey is what it's called. And check it out. There's like some good stuff on there and a cute little picture of a hurt liver. So it's a nice thing. All right, you guys have a good night. Talk to you guys soon. Bye.